Open access advances research. Open access helps research to be more productive by facilitating access to the latest studies. Open access also enables new techniques for computer-assisted research, paving the way for scientific advancements. Moreover, open access improves scholarship, specifically visibility and impact of scholarship. Open access articles are downloaded more and cited more frequently than articles that are accessible only through a subscription. There was a study done that showed that open access articles are downloaded more frequently because they're more accessible. You can access them without any cost, so more people are willing to download them. And also, open access fulfills researchers' professional responsibility to maximize the impact of their research. So, you may be asking, what action is TAMSA taking regarding all these benefits? So, TAMSA, in the recently ended TAMSA Scientific Conference, we came up with declarations and strategic plans for implementation. One of them is holding regular meetings that promote open access within the comprising chapters across 7 medical schools throughout Tanzania, which are these. So these are the 7 schools across Tanzania, medical schools. And the highlighted ones are especially forward in uptaking open access into their system. So furthermore, TAMSA will promote open access usage in different schools, like we have here, I'm sure. Besides just medicine, we have pharmacy, laboratory sciences, nursing, diagnostic and imaging sciences. So we need to encourage this in all schools of the healthcare field. TAMSA will also seek to establish open access institutional repositories. Now, repositories are databases which are institutionally defined. They contain all scholarly articles. They're cumulative and perpetual, as well as open and interoperable. So anyone who wants to visit or access literature in those databases can do so without any hindrances. And TAMSA would also encourage an alternate route so that academicians in respective institutions would publish their research literature in open access journals. Now we have the traditional closed access journals like you saw, but we even have open access journals that do not charge the end user anything. So we have Biomed Central, remember the pen, ICAP, which is the International Coalition for the Advancement of Academic Publishing, PubMed, of several others. So, TAMSA has also opined to spread the message of the open access movement to other student bodies across Tanzania, besides just the healthcare field, academics, and government and quasi-autonomous organizations, so that all publicly funded material is accessible. Now, let's look at the benefits of open access in practical terms. We have an example of a 16-year-old boy in the United States who's made a cancer breakthrough. He's called Jack and Draper. And he's made a breakthrough in pancreatic and lung cancer. What he's done is to come up with an innovation, a new diagnostic test which can detect these cancers at the earliest stages. And it is 3,000 times cheaper than the conventional test, than the test which is being used presently in hospitals. It costs only 50 shillings to do it. It takes 5 minutes to give results, instant results. It is 99% accurate as compared to the conventional test, which is barely 80% accurate. And it detects these cancers at the earliest stages. So therefore, patients have a better prognosis upon diagnosis. Usually